It's time for our Vidant Spotlight, and we do this about once a month. We find out what's going on at Vidant. Of course, the month of October, we see all that pink, so it's Breast Cancer Awareness Month. So we're going to get a little update on cancer treatments and what's available, and some very exciting news about things happening at Vidant Medical Center. First, to my immediate left is Debra Mascarenhas, who is a nurse navigator at Vidant Medical Center. Good morning to you, Debra. Did I get the name right?
You did.
I did. I've been practicing. And next to her is Dr. Manny Zervos, who's the executive director of the Vidant Cancer Center. Good morning, sir. How are you?
Great.
Just meeting you for the first time. And I apologize. I made it sound like you just arrived like last week, but you've been here for 10 years. I apologize for that.
It's okay.
There are some free services available to people, are there not, to be checked for screening and those kind of things? What's Vidant doing this month to kind of commemorate Breast Cancer Awareness Month?
Well, we actually have a free screening next week. You can contact Cancer Services if you need a free screening, because we're going to have one next week. There's also the BSEP program, which is in most counties in the state for women who are uninsured. They can go to their local health departments to enroll in the BSEP program to get their free screenings.
Dr. Zervos, breast cancer is a huge problem, I'm sure, in eastern North Carolina as it is across the country. What's your advice to people on how often should women be screened?
So yearly mammograms starting at the age of 40, that's a little bit controversial, but we still adhere to the original recommendations, and then, of course, breast self-examinations every day.
So at least once a year starting at age 40?
Yeah.
And women should be checking themselves on a regular basis. Yeah. And you know, we've talked about this in the past too. You don't hear many instances of men having breast cancer, but it does happen, does it not?
Absolutely, and we have actually a higher than average incidence of male breast cancer in eastern North Carolina.
Again, there are free screening opportunities if people want to be screened for breast cancer. This is the month to be thinking about that, and contact. Where do they get the information again on the free screenings?
The local health departments have the BSEP program, and they can call Cancer Services, look on our website to enroll in our free screening that we have coming up next week.
Okay, great. Hey, let's talk about that big new tower that's going up on the campus of Vidant Medical Center. When you drive down Stantonsburg Road now, you see another huge tower. That's the new cancer center. I believe I heard, is it a $180 million facility, something like that? As I recall, when the ground was broken, or it may be more than that. I can't really remember.
It's a little more. It's going to be close to $200 million.
$200 million facility. And when is that going to open? It should be open sometime in the spring, I've been told?
March 25th
Yeah.
will be the official first day, and as far as I know, we're on schedule to open on that date.
So how's that going to impact cancer treatment in eastern North Carolina?
Well, it's going to really consolidate cancer care in this community and the region. Along with the opening of the cancer hospital, there is a system-wide effort to standardize cancer care across the region, across eastern North Carolina, especially at the Vidant-owned hospitals in Ahoskie and Tarboro, Washington, and the Outer Banks. And all of that, this momentum that's generated by opening the new cancer center is spilling out into the region, into the community. A new radiation facility in the Outer Banks, a new infusion center in Tarboro. And all of this is going to feed into the central hub here in Greenville, where disease site experts are going to be available for consultation for citizens across eastern North Carolina. We'll try to keep care close to home as much as possible, but when the patients need to come locally to get specialty care like surgery or radiation therapy, in some cases with the unique equipment that we have here, we'll be able to get them here, provide the services, and then get them back close to home in their community.
You mentioned that there's a higher incidence of men with breast cancer in eastern North Carolina. What about regular cancers? Do we see anything unusual about the kind of cancer that pops up in this region of the state?
So across the board, and when we look at the most common cancers in the state in general, Eastern North Carolina, our 29-county region, has a higher, not only higher incidence of those cancers, so that's the common cancers, colon, prostate, breast, lung, but head and neck cancer, but not only a higher incidence, but also our mortality rate in some, especially amongst African Americans, is almost 1.5 times higher than, say, the central portion of the state, for example.
Is that because people are not seeking treatment or maybe not seeking screening as much in this part of the state as in other parts of the country?
Yeah, we think it's probably a confluence of a lot of different factors, that being one of them, access being another one of them, and biology probably playing a role in it as well.
Yeah.
We know that some of the cancers that we see with a high incidence here in Eastern North Carolina are those cancers that are typically described as the bad actors, and we see more of them here than anywhere else in the state.
When I hear those kind of things, it makes me think two things. Number one, how fortunate we are to have Vidant here in Eastern North Carolina serving the counties east of I-95 and in some cases even west of I-95 because, we have some serious medical issues in Eastern North Carolina, and I'm a firm believer. I've said this many times. I'm a firm believer that no one can do that in Eastern North Carolina but Vidant. I think that when you've got an operation that's dedicated to the people of Eastern North Carolina for the people of Eastern North Carolina, I think that it's a wonderful thing, and we certainly benefit from what's happened at Vidant Medical Center and Vidant Health over the years.
Yeah, I couldn't agree with you more. We're under continuous, I wouldn't say threat, but our competitors are moving in around our flanks with the intention of coming into our region and trying to grow their systems in our region. But there really is, Henry, no one better to serve this population than this population, and that's what defines us as a healthcare system. We are Eastern North Carolina.
I was glad to see UNC Healthcare go west to Charlotte for a change, because again, I think that people in Eastern North Carolina have benefited immensely from what's happened with the growth of Vidant Health here in Greenville and throughout the region, and I just get very concerned when we look down the road. I mean, we've got to keep Vidant Health strong, and we've got to continue to grow the services there, which is what this cancer center is all about, creating another opportunity for people to have those kind of world-class services for cancer and other things right here in Eastern North Carolina. And my goodness, growing up, nobody would have ever thought that would have happened in Eastern North Carolina.
Yeah, I don't think anyone would have ever pictured a level 1 trauma center, a dedicated children's hospital, cardiovascular hospital with an outpatient and research institute. And cancer is the next, the next frontier for us in Eastern North Carolina, and it's quickly becoming the #1 cause of death in our region. And it's only fitting that not only our healthcare system, but our citizens and our population get behind us and support this effort.
Dr. Manny Zervos, who's the executive director of the Cancer Center at Vidant Health, and Debra Mascarenhas. Again, it's Breast Cancer Awareness Month. Debra, anything that I haven't asked that you want to talk about that people need to know about breast cancer, or anything regarding your services at Vidant?
Well, I think the important thing to get out there is women need to go and get their screenings. The earlier they're diagnosed, the higher the survival rates. So women that are diagnosed in early stage 1, where the disease is limited to the breast, their survival rate is 99% at 5 years.
Yeah.
And it goes down to 85% if it has spread to the lymph nodes and to the arm. But if it goes to a distant place, then the survival rate goes down to like 26% at 5 years. So it's really important to go get your screenings so that we can diagnose you and treat you early with a high rate of cure.
We can do so many things, or you guys can do so many things now that we didn't used to be able to do with screening. You think about colon cancer and what's happened with colonoscopies and endoscopies and things like that we didn't used to have. And so with all this screening available, people need to take advantage of it. And thank God we have Vidant Health here in Eastern North Carolina to do that. So get screened, people. Get screened for all these cancers. Right, Doc?
Absolutely. And there's going to be a big focus in the new cancer hospital on cancer prevention, and early detection and screening is the foundation of early detection.
You know, I'm still amazed because colonoscopies have been around now, what, 20, 25 years? How long have we been doing those?
Probably 50 years.
50 years. But you didn't hear much about it, though. I mean, people were really I mean, everyone was starting to get them, I don't know, 20, 25 years ago, it seems. But I'm still amazed when I talk to somebody that's over 50 years old that hasn't had a colonoscopy. And I you know, I immediately kind of get incensed and say, you got to go get one, because, you know, we all have friends who didn't go get screened, who ended up with some serious problems. Our friend Jeff Charles, the voice of the Pirates, will be the first to admit that, you know, I've heard Jeff talk about this. You know, he didn't go get screened, and he ended up with some serious problems. So you got to go get screened.
Yeah, absolutely. That's not something that's limited to uneducated or low socioeconomic people. We see it across social strata. We see people presenting late here in Eastern North Carolina, and hopefully the attention that's brought to the community with the cancer center, with these types of breast awareness activities and other cancer types will get our screening rates up to what we should expect. And for colonoscopy, it really should be 80%, was what we're shooting for. 80% of people age 50 and older have had colonoscopy, and that's our goal.
And it's just nothing to it. It's just absolutely, people get fear what they don't know, but there's just nothing to getting a colonoscopy, and nothing to get a breast screening, probably. I don't have to have those, but I mean, or should men get them? I don't know.
Men don't need to get screened.
Yeah.
They should just report any lumps or anything abnormal.
Okay. Good to see you both. Thank you for all you do.